Here's the problem, plain and simple. MAID is being done without anesthesiologists. That means people are being injected with lethal drugs without the medical professionals who are trained to manage deep sedation, prevent pain, monitor breathing and heart function. The drugs used, like midazolam and propofol and rocuronium, can cause terror, pain, and suffocation if not properly dosed and monitored. When done wrong, the patient feels it and can't move or scream. That's not dignity, that's torture. In surgery, if something goes wrong, an anesthesiologist is there to fix it. In MAID, there's no second chance and no anesthesiologist. And yet, Canada allows this to happen behind closed doors. And that's the core problem. So thank you very much for tuning into my video here. This is the issue, and I do believe this argument has merit, and there is no there's no other reason why this is happening except a budget. It's and the logistics of it. I mean, there's you talk about access and all this stuff. Okay, access. Access to what? Torture? Death? Yeah, it's gonna. You are gonna die. Don't worry, there is gonna be death. But so for example, my buddy, his letter starts with R, so we're just gonna call him. Let's just call him an R name, any R name, right? Ralph or whatever his name is. Another, it's not his real name, but Ralph here. So Ralph, I know Ralph, and I know that he was just getting sick and tired of being sick and tired, right? And yeah, he said, yeah, I'll just get the maid. So the maid came in, and yeah, he certainly died. So he took in one last Pepsi with his a real, a Pepsi, which was basically the cause of his illness. He was diabetic. He had multiple medical issues that were plaguing him and all that stuff. But so one last Pepsi with the family, and then he took the maid. But I know this our named guy, Ralph or Ray or whatever his name is. I'm just not sharing his personal information, but I know him, and I know that he was sedated and he couldn't move or anything, but he felt the fluid go into his lungs, and it was so incredibly painful. And he would have clocked the maid. He would have clocked the maid, and clocked him right in the face. Because it's painful, right? It's an extremely painful thing, but you can't do anything. And then the guy died, and he's to this day, he cannot complain or anything. So who is the voice for the voiceless? All right, that's what I'm trying to say here. Well, this channel certainly could be, but it just seems like this is just. You're cutting corners, you're doing it sloppy, and the Clare Health Center certainly has, been doing some, so really, dodgy stuff there. So we should be thinking a little bit about what's going on here. So the thing is, an anesthesiologist is certainly I'm sure I'm not the first guy to presented, that put forth this argument. I think this argument has been surely somebody thought about it. I mean, it's medical assistance in dying. I mean, I'm sure everybody should be thinking about an anesthesiologist being present when you're administering these lethal drugs. I don't for a minute believe that I was the first one to propose that, but maybe I'm the first one to make a YouTube channel about it, or maybe there are some. Maybe I'll get canceled. I don't know. YouTube does not like the truth and everything, but it seems like to me, on first glance, it's just not right. Thank you very much for tuning in. I do appreciate your presence here on the YouTube, on this very brand new, cutting edge, fresh off the press YouTube channel. Thank you very much for tuning in. I'll see you next time.